So you've done the hard part and you've lost the weight, but now the excess and damaged skin won't go away no matter what you do. This is where I come into play. Hi, I'm Dr. Eric Barker, and I'm a plastic and reconstructive surgeon here at Peak Plastic Surgery in Denver, Colorado. I specialize in breast and body cosmetic surgery. So the question of why skin doesn't bounce back or retract after massive weight loss or rapid weight loss with GLP-1 medications is a very complex question, but what it really boils down to is after massive weight gain and then loss, your skin integrity, the elasticity, and its ability to contract and recoil is severely damaged. So that is the typical reason why you will have a significant amount of loose, damaged, and excess skin following massive weight loss. So many times I'm asked the question, what is body contouring or skin removal surgery, and what does it involve and what does it achieve? This is a very broad question, which really is broken down into body contouring is any procedure and or surgery that helps contour and change the curves of the body, whether we're talking about arms, breasts, abdomen, legs. And after massive weight loss or even just pregnancy, natural skin sagging with age, skin removal surgery is a subsect of body contouring. So really when we talk about body contouring, we're going to be talking about the overall body changing procedures that I do each and every one here at Peak Plastic Surgery Center. So when patients come in and ask what procedures are they a candidate for after GLP-1 use with weight loss, it really depends on the individual patient. Some patients after GLP-1 medications will have a significant amount of weight that's lost, resulting in a significant amount of excess skin. These patients typically will require skin removal surgery such as arm lifts, breast lifts, tummy tucks, leg lifts. Some people have mild skin excess that need just small procedures such as VASER lipo contouring with skin tightening. So each patient needs to be treated individually and customized so that after their GLP-1 medication process and their weight loss journey, that they're able to achieve the end results they were hoping at the beginning. So with the onset of GLP-1s for weight loss, the surgical field has really come up with a lot of guidelines so that how long should a patient be on and or off when we're talking about surgery. For my practice, I like to go on a more conservative manner to ensure that patient safety. So what we do for GLP-1s, if you're having general anesthesia, we have you off them for 2 full weeks with 24 hours of a clear liquid diet prior to your surgery. If we are doing an awake surgery, such as VASER lipo contouring in my office, small skin removal procedures, I tell you I would like you off them for 1 week prior, just to ensure that we'd have no gastric emptying issues, because we typically will medicate for oral anxiolytics. When patients come into my office after massive weight loss, many times they would like their procedure immediately. Ensuring that I treat patients as a whole and not just treating them as a number is I want to ensure that their weight loss journey has ended and they're at a stable weight. So typically when we're talking about massive weight loss, I like my patients to be stable for about 6 months prior to any surgical procedures to ensure that their weight loss ups and downs have stabilized so that their end results are the best that we can possibly offer. Procedures after massive weight loss many times are staged. The reason for that is after massive weight loss, skin excess and damaged skin do not typically occur in just one area of the body. It is typically multiple. So when we're having to deal with multiple areas such as arms, breast, abdomen, back, flanks, legs, doing all the surgeries at one time is not safe, and the recovery is not going to be the optimal healing potential for each individual patient. So we do break them up and we stage them, and I will go over each opportunity for staging with each patient, because not always do you have to do the same protocol for each patient. We want to make sure that the patients end up with the end results that they're hoping to achieve. So after massive weight loss, when you have excess skin, many times there are a lot more issues that come than just the appearance of excess and damaged skin. You get skin chafing. You get areas that are moistened that will always end up in skin breakdown. You will get rashes. A lot of times it can be difficult with clothing to ensure that they fit appropriately. So when we're talking about massive weight loss, skin excess and damaged skin, it is not just a cosmetic appearance. Many a times these procedures after the massive weight loss skin removal surgeries, the patient will feel more contoured. They will also feel more confident in the fact that they no longer have areas of pain, rubbing, chafing. There are many problems with the excess skin following massive weight loss, and they're not just cosmetic, which is why it's such an important issue to be talked about in a very clear and understanding manner. Massive weight loss skin removal surgeries can be very large in surface area of the body. So when we're talking about recovery after these surgeries, they need to be very well understood when talking to the patient of what is the expectation for recovery. So for each one of my patients, when I'm offering any massive weight loss skin removal surgeries, we go over in depth during the initial consultation process. What does the recovery look like? Timing. What are the restrictions for weight? Position. What can you do on a daily basis? What should you not do? These are all things that need to be well understood prior to the surgery so that when you are in the recovery period, you understand what's coming and that you are able to get through it in a very easy and comfortable manner. So following massive weight loss, when we're talking about candidacy for surgical intervention, there are times where patients will be an excellent candidate, and there are times where patients will need to take a little extra time prior to the surgical intervention. When we're talking about a good candidate, we're talking about somebody who's had massive weight loss that's been stable for the appropriate amount of time and is in overall good health. So for each one of my massive weight loss surgeries, we send you to your primary care physician to ensure that you are in the best possible position for the surgery and recovery through a medical clearance. And for patients that may not quite be to the point of candidacy, this may be because you're still losing weight or you still have medical conditions associated with the weight prior to the massive weight loss that need to be addressed prior to undergoing surgery. So I will take the time to sit down with you, ensure that your candidacy is in the appropriate spot, and we will treat you as a person as a whole and make sure that you are medically appropriate.